Curious about Wellbutrin? Wondering what it's used for and if it could be beneficial for you? In this comprehensive video, we will explore the common purposes, advantages, potential side effects, dosage recommendations, and risks associated with Wellbutrin. Wellbutrin, a popular brand name for the generic drug bupropion, is primarily prescribed as an antidepressant. However, its applications go beyond treating depression. Doctors often prescribe Wellbutrin to help patients quit smoking, manage symptoms of attention deficit hyperactivity disorder, ADHD, and as a supplementary treatment for seasonal affective disorder, SAD. Common purposes of Wellbutrin. Wellbutrin is commonly prescribed for the treatment of depression. It belongs to a class of medications known as atypical antidepressants. Unlike selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, Wellbutrin works by affecting the levels of dopamine and norepinephrine in the brain. This unique mechanism of action sets it apart from other antidepressants and makes it an effective option for some individuals who have not responded well to other medications. In addition to depression, Wellbutrin is also prescribed to help individuals quit smoking. It is believed that Wellbutrin reduces the cravings and withdrawal symptoms associated with nicotine addiction. This can greatly increase the chances of successfully quitting smoking, especially when combined with other forms of support, such as counseling or nicotine replacement therapy. Wellbutrin is also used as a supplementary treatment for seasonal affective disorder, SAD, a form of depression that typically occurs during the winter months when there is less natural sunlight. Individuals with SAD may experience symptoms such as low mood, lack of energy, and changes in appetite. Wellbutrin can help alleviate these symptoms and improve overall mood during the winter season. Advantages of using Wellbutrin. One of the advantages of using Wellbutrin is its unique mechanism of action. Unlike many other antidepressant medications, which primarily target serotonin levels in the brain, Wellbutrin works by increasing dopamine and norepinephrine. This can be particularly beneficial for individuals who have not responded well to SSRIs or SNRIs. By targeting different neurotransmitters, Wellbutrin offers an alternative option for those seeking relief from depression. Another advantage of Wellbutrin is its potential to minimize sexual side effects often associated with other antidepressant medications. Many individuals who take SSRIs or SNRIs may experience decreased libido, difficulty achieving orgasm, or other sexual dysfunctions. Wellbutrin, on the other hand, has been found to have a lower incidence of sexual side effects. This can be a significant advantage for individuals who are concerned about these potential side effects and want to maintain a healthy sexual functioning while undergoing treatment. Additionally, Wellbutrin has been shown to have a relatively low risk of weight gain compared to other antidepressants. Some individuals may be hesitant to start antidepressant medication due to concerns about potential weight gain, which can negatively impact self-esteem and overall well-being. Wellbutrin offers a potential solution for those who want to manage their depression without the added worry of weight gain. Potential side effects of Wellbutrin. As with any medication, Wellbutrin does come with potential side effects. These can vary from person to person and may include symptoms such as dry mouth, headache, nausea, insomnia, or increased anxiety. It's important to note that not everyone will experience these side effects, and they are typically mild and temporary. However, if these side effects persist or become severe, it is important to discuss them with a healthcare professional. In rare cases, Wellbutrin may also cause more serious side effects such as seizures, allergic reactions, or changes in mood or behavior. It is important to seek immediate medical attention if any of these symptoms occur. Additionally, Wellbutrin may interact with other medications or substances, so it is important to inform your healthcare provider of all the medications, supplements, or recreational drugs you are taking. Dosage recommendations for Wellbutrin. The dosage of Wellbutrin prescribed by a healthcare professional will depend on several factors, including the individual's age, medical history, and the condition being treated. Generally, the starting dose for depression is 150 mg per day, which may be increased to 300 mg per day after a few weeks if necessary. For smoking cessation, the recommended dose is usually 150 mg per day for 3 days, followed by an increase to 150 mg twice daily. It is important to follow the dosage instructions provided by your healthcare professional and not to exceed the recommended dose. Taking more than the prescribed dose can increase the risk of side effects and may not provide additional benefits. If you have any concerns or questions about the dosage of Wellbutrin, it is best to consult with your healthcare provider. Risks associated with Wellbutrin. While Wellbutrin can be an effective medication for many individuals, it is important to be aware of the potential risks associated with its use. One of the main risks is the potential for seizures, particularly in individuals who are already at risk for seizures or who have a history of seizures. The risk of seizures is dose-dependent, so it is important to adhere to the prescribed dose and not to exceed it. Another potential risk is the potential for increased suicidal thoughts or behaviors, particularly in children, adolescents, and young adults. It is important to closely monitor individuals taking Wellbutrin, especially when starting the medication or when the dosage is adjusted. Any changes in mood or behavior should be reported to a healthcare professional immediately. Additionally, Wellbutrin may interact with other medications or substances, potentially increasing the risk of side effects or reducing the effectiveness of other medications. It is important to inform your healthcare provider of all the medications, supplements, or recreational drugs you are taking to ensure safe and effective treatment. Wellbutrin versus other antidepressants. When considering Wellbutrin as a treatment option, it is natural to compare it to other antidepressant medications. Wellbutrin differs from SSRIs and SNRIs in its mechanism of action, as mentioned earlier. While SSRIs and SNRIs primarily target serotonin levels in the brain, Wellbutrin increases dopamine and norepinephrine. This difference in mechanism of action can result in different side effect profiles and may be a determining factor in choosing one medication over another. Some individuals may find that they respond better to Wellbutrin than to SSRIs or SNRIs, while others may have the opposite experience. It is important to work closely with a healthcare professional to find the medication that is most effective and suitable for your individual needs. Wellbutrin and its effect on different mental health conditions. In addition to its primary use as an antidepressant, Wellbutrin has shown efficacy in managing symptoms of attention deficit hyperactivity disorder, ADHD. It may help improve attention, reduce impulsivity, and decrease hyperactivity in individuals with ADHD. However, it is important to note that Wellbutrin is not a first-line treatment for ADHD, and other medications or therapies may be more appropriate depending on the individual's specific needs. Wellbutrin has also been studied as a potential treatment for anxiety disorders. While it may not be the first choice for anxiety, some individuals may find that it provides relief from symptoms such as excessive worry, restlessness, or panic attacks. Again, it is important to consult with a healthcare professional to determine the most suitable treatment approach for anxiety disorders. Precautions and considerations when using Wellbutrin. Before starting Wellbutrin, it is important to inform your healthcare provider of any pre-existing medical conditions, such as epilepsy, eating disorders, or liver or kidney problems. Wellbutrin may not be suitable for individuals with certain medical conditions, and alternative treatment options may need to be considered. It is also important to note that Wellbutrin should not be abruptly discontinued without medical supervision. Your healthcare provider will provide guidance on how to safely discontinue Wellbutrin if necessary, as abrupt discontinuation can lead to withdrawal symptoms or a recurrence of symptoms. Conclusion. Wellbutrin, also known as bupropion, is a versatile medication that is primarily prescribed as an antidepressant but also has applications in smoking cessation, managing ADHD symptoms, and treating seasonal affective disorder. It offers advantages such as a unique mechanism of action, potential for minimal sexual side effects, and a lower risk of weight gain compared to other antidepressants. However, it is important to be aware of potential side effects, dosage recommendations, and risks associated with Wellbutrin. If you are considering Wellbutrin for yourself or a loved one, it is crucial to consult with a healthcare professional who can provide personalized advice and guidance based on individual needs and circumstances. Medication should always be approached in conjunction with other forms of treatment, such as therapy or lifestyle modifications, for the best chance of achieving overall well-being.